It's time. Ooh, we got a red countdown at the top. I think we're live.
Oh, we can see who's watching too.
Awesome.
See who
I
hops
can't
on.
do that on my end. You must have that backdoor, that special presenter access. I don't get to see that.
Yes. So for those of us who are joining us, whether you're on Facebook, on the San Diego Pain Summit Facebook page, or the Twitter at San Diego Summit, or if you're on the YouTube channel, my name is Rajem Roos, and I am the CEO and founder of the San Diego Pain Summit. And I'd like to introduce Dr. Jason Silvernail. And as you can read from the ticker at the bottom, if you purchase the 2022 live stream package for the conference that's coming up here in just a couple weeks, you will get a free 45-minute consultation with Jason. And that's every single person who signs up for the live stream package will get that. And he will be contacting you to schedule your appointment sometime during the year. And of course, with the live stream, it's not a typical virtual conference. You are actually going to be there participating, watching everything in real live time. You'll be in discussion groups with other online viewers, and you will have access to the recordings after. And you will also be able to interact with the presenters in the Q&A sessions. So that's what you get with the live stream package. And I will let Jason go ahead. I think you wanted to talk about your topic that you were going to present.
Yeah, I'd love to. And thanks. It's great to be here. It's great to be on a program. I'm so used to the little San Diego Pain Summit icon up there. I'm super happy to be here. I'm excited to talk about some of this stuff and hopefully get some other folks an opportunity to come in and pick that live stream up, and just the quality of education that you offer every year, Rajem. I feel like it just gets better, and I'm glad to be a part of it this year. So let's talk a little bit about that and about what some of our options are. So I'm Jason Silvernail. I'm a doctor of physical therapy, a career military officer, and I've been in medicine for over 20 years, and in the military for over 30. And I started to realize that there's in the medical space, there's a lot of people talking about a lot of very good clinical topics. And one of the funny things about my line of work is that I end up in leadership or management positions a fair bit of the time. And I started to see a pattern that we were just having some conflicts come up. And some of that is normal, right? People are people. People are going to have conflicts, and it's your job as a leader to sort them out. But I noticed that between the pandemic of the 2 years of everybody's having less interpersonal interaction and more interaction on the screen, it's easy to be harsh to somebody over the screen, isn't it?
When you're mad about
exactly
when you're mad about pineapple on your pizza.
Exactly. I feel like whoever wants to have pineapple on their pizza, they're not just wrong. They're a terrible person, and they're a threat to our country.
Let's save this argument that kind of thing, for another time.
We must have to. We needn't agree about that, a pineapple on the pizza, right? But so I think we've kind of lost the sense of how to interact with people in a positive way, and how to recognize when things are going off track and how to move them back on track. And I noticed that when I was in leadership positions and I was trying to teach other people to be leaders and managers and to handle these kinds of things, they didn't often have as many skills as I would have liked them to have in de-escalation and conflict management. So I started talking more about it. And I started talking more about it in the leadership videos that I do on social media. You can follow me on social media, Facebook, Instagram, LinkedIn. I even have a TikTok account at Jason Silvernail, all one word. Come find me, interact with my stuff. It'll be fun. And I started talking a little bit more about, conflict management. And I realized that this is just an area where all of us have a stake. And this is an area where all of us, I think, need some basic skills. Now, especially in the medical or fitness context. And I'm going to go over a lot of really interesting things about where conflict comes from between people and how it can escalate, and some of the unfortunate things that can happen, and be careful about it. And I want to talk a lot about practical skills that people can apply the very next day to help them feel safer and more comfortable when things get tense. When people start yelling, when people start pointing in your face, you're going to have a skill set to go back to and say, I know what to do. And you're going to kind of walk yourself through that, through that skill set, and be able to de-escalate and solve a problem without things getting bad. And that's the kind of thing I'm going to talk about at the San Diego Pain Summit and this year. And while you're here, as Rasham said, if you sign up for the live stream package while we are talking, I will book a 45-minute consultation session with you later on this year. And I know what you're thinking. Why do I want to talk to Silvernail for 45 minutes, right? Well, there's a couple of different reasons. Number one, we can do a follow-up and talk in more detail about some of the things that I talked about at the summit this year. The topic is conflict and safety in clinical spaces. And we can talk about some of those tools. We can work through problems that you've got in your individual area. We can also talk about anything else that you want to talk about. Probably not sports, because I'm not really a sports guy, so I'm not going to have much to contribute there. But you know what's funny thing about all this pandemic? We talked before about like people on the keyboard yelling at each other. That does sometimes happen, right? I have to say, I've been there too. I'm not a perfect person. I've done my share of yelling on the keyboard too. We have lost, I think, the ability to have a high context conversation. And a high context conversation is one where two people know each other and they both have kind of a stake in that relationship one way or another, right? And it doesn't have to be a close relationship like a family member. It can be a professional relationship or someone with a work colleague or somebody like that. And in a high context conversation, the temperature on conflict tends to be lowered and you get a chance to really work through some things. And so there's a lot of pending professional issues out there in the world that people might want to talk about. People might want to talk about concepts of leadership in the clinic. They might want to talk about evidence and practice. They might want to talk about, does manual therapy suck? Like I'm happy to have these conversations with folks, and I want to be able to have that time and use that time in a way that helps people and that can be useful to them.
Yeah, and so I think you also wanted to share a couple things during this chat that you're not going to be sharing in your presentation coming up here in a couple weeks.
100%. So if you're at all interested in this topic, conflict and safety in clinical spaces, I'm going to talk about in a minute or so, I'm going to talk about a different kind of thing about that topic that I'm not going to talk about at the summit this year. So if you're interested in this topic and you see this presentation and you see the one at the summit, you're getting a lot of information you wouldn't otherwise have got, right? So what I want to talk to you about today in terms of understanding how conflict tends to grow with people. Actually, let me go one step back before we do that. When people think about conflict between individuals, you know what they always think about? They think about the physical stuff, right? They think about self-defense stuff, right? And when people say self-defense, they think about the physical part of it. And I'm not saying that's not important, right? I think that is important, but that's a really small slice of the conflict that we face on a daily basis. Almost all of the conflict that we see is verbal and interpersonal interaction. It's not physical. And the stuff that is physical, almost all of it starts at the interpersonal and conversational level. So if you know how to de-escalate and recognize things when they're going bad, and I'll talk a lot about that at the summit this year, you'll be able to steer people off that path and you'll be able to avoid things having to get physical, right? So I think that's an important piece of the puzzle to talk about. So one of the authors that I think you should read if you're interested in this space is a guy named Gavin de Becker, D-E-B-E-C-K-E-R, Gavin de Becker. He wrote this book called The Gift of Fear. Yeah.
Yeah, then I'll put that up at the top. D-E.
Yeah, that'd be great. D-E-B-E-C-K-E-R, all one word, de Becker. Gavin, G-A-V-I-N.
I love that book.
Isn't it great? Oh my gosh, read that book probably 20 years ago. Fantastic book, right? And so Gavin de Becker studies violence, and he studies protection in like like a celebrity kind of sense, right? And after doing so many years of this, he started picking up examples and seeing the way that people behave, right? And he kind of developed this framework called JACA, or J-A-C-A, right? And the JACA framework, which again I'm not going to talk about at the summit, but I will talk about today, is an acronym. So I'm a soldier. I love acronyms, right? And so that acronym stands for justification, alternatives, consequences, and ability. And when you start to see conflict build between people, using that framework can be very helpful, right? So how many times have you picked your phone up and you've just seen some sort of video going viral and of people just acting up, right? Just doing things that maybe they normally wouldn't do. And you have to assume this is a perfectly reasonable person in most of their life, but look how they're behaving at the Wendy's, like, or on the airplane.
Or that
when they're
guy
going
that
away
threw a
and that-
drink. That guy that threw a drink at a woman, and then he shows up for his court date, and you would have never guessed that he was prone to that kind of outburst.
Absolutely. Absolutely. Right. And so I think that JACA framework can be very useful. Right. And so here's how it works. So the first reason that people escalate conflict is that they feel like escalating that conflict is justified. Right. That's what the justification is for. So what would cause someone to feel justified? Well, they have to feel like they're in the middle of an injustice. They have to feel like an injustice is being inflicted on them from someone else, and therefore their acting up is a response to that, and they are justified in that kind of righteous and conflict response, right? So how does that help us? Well, one of the things that helps us do is it helps us realize that when we interact with someone else and they're starting to escalate the conflict, we need to interact with them in such a way, by asking questions and providing options, in such a way that reduces their sense of justification for their behavior, right? And what you're gonna hear them do is they're gonna start to speed up their voice. They're gonna start to make their voice louder, and they're gonna you can feel them sort of building themselves up with a sense of sort of righteous anger at this injustice that's being placed on them. Now, I'll give you an example at the clinic, right? So we had a patient that was arriving quite a bit late for their appointment. And one of our frontline staff members says, I'm sorry, your doctor's already seeing someone else. But so what we can do is see what we can do to reschedule, or we can talk. And she didn't even get that sentence out of her mouth. And he's immediately kind of yelling, and I've just been here, and how can you do this? And I've had this appointment for weeks. And how many of us have been there, right? Like, you're in physical therapy, you're in medicine, you're in massage, you're in personal training. I bet you've had this exact same thing happen, right?
Or as the person, how many of us have had an appointment that we've been waiting, that we've scheduled, we've had a bad day, we're in a lot of pain, and then we're told,
and how does that feel, right? Mm-hmm. It feels pretty crappy. It feels like an injustice. And so this guy was getting pretty mad, right? And so one of my managers up front, I've been working with him a little while, and so he kind of had some skills in this area. And one of the things he did is he came up and said, "Hey, sir, what's going on? How can I help you here?" And the guy started talking to him, and he said, "Look, it's really unfortunate that you're late and your doctor's working with somebody else. But the good news is I have a lot for you. I mean, we can do a whole bunch of different things. Number one, if you have time to wait today, we'll absolutely get you in with your doctor or with another doctor today. I can also offer you," and he's sort of moving through those other options, right? Now, it's hard to sustain being mad and feeling like you're justified in being in escalating a conflict if the other person is giving in as you talk, right? It doesn't give you the pressure you need to continue to spin up and get angry. And so his justification for being mad starts going down as he talks. And what happens then? Well, his volume gets lower, and this pace of his speech slows down, and his aggressive, nonverbal behavior slow down. And that is an important part of getting us to that next step. That sense of justification. People are angry and escalate conflict because they feel they are justified. When you interact with them by asking questions and talking in such a way that reduces the importance or salience of the injustice that they're talking about, it reduces their sense of justification to escalate the conflict. And it's a really important thing that you can do to reduce and to offload some of that conflict as it happens. And that's the first letter in the framework of JACA is J for justification.
I was just going to say, and it's also really helpful to, sometimes it can be hard to listen to the person who is upset. I was in a situation and somebody was upset at one of my conferences, and I didn't fully understand it took a few minutes to realize, oh, well, this is what they wanted. I thought that maybe they wanted something else. And they're like, it was something with the food, and they were like, I
Yeah.
just want to eat. I don't care about my money back, So once I realized, okay, let's just set that up, but it does take listening to to figure out the reason why, because it may not be as simple as they may not be expressing exactly what they're upset about. Sometimes it seems like
100%. That's so true. I mean, and that's what happens. People are upset, they're angry, and that's a big piece of that. That's a big piece of that conflict piece. That's a big opportunity for people to talk past each other instead of connecting and solving that kind of a problem. You know what I mean? So that's the first letter. The first letter is J for justification. So the second one is A for alternatives, right? People who escalate conflict feel like they have no alternative but to behave in the way that they do in order to get what it is that they want. Now, there could be a lot of different advantages to doing that, because people feel like they're not only are they subject to an injustice, so like they're not only are they justified in being so angry and difficult, but they feel like they're painted into a corner and they don't have any alternative but to act up in the way that they are, right? And so they feel they have no alternative to do that. And so how do we counter that? How do we interact with someone and sort of de-escalate that part of it? Is that one of the big, and I just talked about my manager doing it a couple minutes ago, is providing better alternatives for people. First of all, listening to see what their concerns are and then offering them options, right? And so it's hard to be angry at somebody who is asking questions and presenting options to you that you can select from. And so that guy who showed up and he was late and he was very, very angry, and the manager just sort of gave him some options. Here's what we can do today. We could reschedule your appointment for another time. I'm happy to let you sit here. We have like a little standby area. It's kind of like an airline. We have like a little standby area where another doctor can bring you in as soon as we're available. Or you can schedule for another person another time. Or if you want to wait to be seen, we will absolutely see you today. We have committed to seeing you today. I know it wasn't your fault that you arrived late, because who arrives late on purpose? Nobody does, right? So something must have happened. We understand it's an imperfect world. And here are your options. What do you think would work best for you? And how can I help us work through this? And when you give people options like that or alternatives to escalating a conflict, very often they're going to stop the conflict escalating about, stop yelling, stop pointing, and start talking, and they're going to take advantage of some of those alternatives as they come through. And that's the second step, is A for alternative. The third step, and in some cases, sometimes my favorite, is consequences, right? So people act up sometimes the way they do because they feel like there are no or minimal consequences for doing what it is that they do. And this is a really interesting sort of side theme that's happened, right? So as powerful and as beneficial as social media is, it also kind of has a dark side too. And one of those dark sides is that people can sometimes find their way into these sort of little bubbles where they're just surrounded by people who agree with them. They're not used to interacting with people who disagree. And so when they encounter disagreement, it's not a simple disagreement like pineapple on the pizza. It's actually some sort of existential threat to their personality or to a very important personally held value that they have. And that causes them to really escalate. And especially when we're sort of insulated from each other behind a mask or through a distance, or as many people as we have who are working remotely, we can sort of lose sight of what the requirements are and what it's like to interact with people on a person-to-person basis daily. And so I thought the example you gave earlier was really interesting. But there probably was a video of a guy getting mad and throwing a drink at somebody, and then cut to 2 months later, at the court date, there he is, and he's got his dress shirt on, and he's looking like an appropriately normal person who would not freak out and throw a drink at somebody, right? At the time he was doing that, he didn't have a sense of what those consequences might be, right? So when we talk to somebody, giving them a sense or helping them reflect on what the consequences of their behavior are is an important part of what we can do to de-escalate conflict. Now, I'm not talking about threats. Well, if you don't stop doing that, I'm going to. That's not what I mean about consequences, right? Consequences can be helpful when people reflect on them themselves. right? And reasons we have all this footage of people acting up in public is because everybody has one of these days, right? And every camera now. And so one of the things we can do when we're in a public setting, like maybe the front desk at your clinic or gym, and we see some conflict, is help people understand that if things get out of hand here, somebody's gonna video this. And this will be up on YouTube and Facebook and Twitter and all those other places, right? And so acting up and being seen on video, on social media, on a video that goes viral, maybe not being your best self, maybe being kind of a huge jerk to somebody who doesn't deserve it, like that's a consequence that's very salient or worthwhile paying attention to for a lot of people, right? Another way to think about consequences is say, look, you're here to get an appointment done. I need to let you know if you don't bring your voice down and we don't talk calmly, you're going to have to leave. You can't stay here and behave like this. That's an example of another consequence, right? So understanding what those consequences are. So people act up because they feel like they're justified. They feel like there aren't any consequences, and they feel like they have no good alternatives, right? So talking about it, someone and de-escalating someone in a way that suggests that there are consequences to their behavior that they have judged themselves to not like. That can be very valuable as part of a de-escalation strategy.
I'm glad you use that as an example because, I am curious, like, how would you, how would that look to explain to somebody what the consequence of their behavior is?
Yeah, one way to just to look around, right? It's just to say, hey, look at all these people. Like somebody's recording this, man. I mean, do we really need to do this? I mean, let's talk calmly about this. We will settle this problem. I mean, I don't want any trouble here. You don't want that either. You're here for an appointment. I want to get you taken care of, but it's not going to work like this. Like, look at all these people with their phones, right? And so that sort of discussion, that sort of invitation or discussion that invites self-reflection, it invites a pause in the person who's escalating their conflict, right? It invites them to stop and think and self-reflect on what it is that they're doing, and that helps a lot. That helps a lot.
And also, just to let everyone who's watching, we do have a few people watching. Feel free to, whether you're watching on Facebook or Twitter or YouTube, you can post a question in the comment and it will appear here for us too. So if you have a question for Jason, feel free to ask about anything that he's talking about.
Yeah, this is a lot easier when there's good interaction. I'm looking forward to the summit, and I'll be able to do some interaction then. We're also going to have a Q&A session after my talk at the summit this year. Isn't that right?
Yeah, so it's going to be your talk is about 40 minutes, and we're going to extend the Q&A talk. Now, the people who've signed up know this, but people who have not signed up yet may not realize that Dr. Silvernail is going to be unable to join us in person. So he's going to join us virtually. So we're going to actually extend the Q&A session, and it's going to be not through the app, the conference app. People are going to be able to talk, and he will be able to see everybody in the audience. And then he's going to stick around an extra 15 minutes if you want to come up to the camera and talk to him or have a few words. So there still will be the engagement. He just won't be there for fist bumps or elbow bumps or any of that stuff.
Yeah, anything we can do. One of my goals in talking about these concepts is to give people actionable skills, to give people things that they can use the next day or heck, even an hour later if they need to. I'm going to give people a simple framework of how to understand how you should behave when some conflict starts, and very practical skills you can apply immediately without any more special training. And an advantage of the Q&A format that we're going to use is that it gives more people a chance to come up with actions. Like, hey, that sounds all nice on your slides, but here's something that happened to me. What do you think we should do, right? And then we can work through those kind of cases together and discuss those things as they come up.
And they may need it when they head back home on the plane, because
exactly, right?
Riding a plane is like, I've been fortunate. I've been on some trips recently, and fortunately haven't witnessed any of that behavior. But apparently, it's out there.
It can be nuts. It can be nuts, right? So, Yeah. So the last letter of the JACO format is ability. Is the A's for so we have justification, alternatives, consequences, and ability. And the A for ability talks about whether someone is able to or has the personal ability to follow through on whatever it is their issue is, whatever the conflict is. Now, most people have the ability to yell. Most people have the ability to point their finger and be loud and difficult, right? Not everybody
I
has the
do.
ability to be. Well, I hope I never get to see it. But not everybody has the ability in any given situation to get physical too, right? So people who had the ability to be physical and to have that be a credible threat, someone who is like, adult sized, and or there's a difference in size and strength between the two people, that sense of ability raises the level of threat of the situation. One of the things that people get afraid of when we think about like physical violence and physical confrontations is they're afraid it'll kind of come out of the middle of nowhere, or that it won't be predictable. And one of the things we do know about violence from the literature is that that's hardly ever the way it goes. Almost all physical confrontation starts as a verbal or interpersonal conflict and escalates, right? So these are very predictable things, and you can learn to recognize them. You can learn to de-escalate them, and you can learn ways to keep yourself safe and get yourself away from the situation if things look like they're going to really turn bad. And I'm going to go over all that in my presentation this year at the summit. So the last A in the framework is A for ability. It's the ability to execute or to follow through, on a physical confrontation. And again, I think that's where when people think about this stuff, that's what they think about, right? They think about UFC and that kind of stuff, and I don't think that's necessarily wrong, but most of the conflict that we're going to face in the modern Western world in 2021, it's verbal, it's interpersonal, right? It's that kind of conflict. And even the physical stuff almost always starts with a verbal or interpersonal conflict and escalates from there. And so being able to recognize those things, being able to de-escalate them when it happens, and being able to take actions to keep yourself safe if things really do go south, those are not optional skills. Those are skills I think we all need in today's world.
Yeah. Yeah, that's really good. So I think maybe we'll just wait a few minutes. No questions have popped up, but we can just wait a few minutes because there is a lag. And then, yeah, it's really dry here in San Diego. I guess it's been just really dry the last 2 weeks.
Wow.
Like I can feel the moisture just sucking out of my skin. Not that anyone watching needs to know that. But this is what people have to expect when they come. I mean, it's beautiful weather for February.
So. Yeah, it's going to be. I'm disappointed I won't be able to make it. I got to tell you, most places in February, cold, overcast, dim, and when we were there in person for the February summit before, gosh, it was just amazing there. I mean, it was right on the coast, and what a vacation it was too. And in February of all times, right? Some people are still going to be shoveling their snow, and people at the summit are going to be out there in the sunshine, staying warm and having some great conversations about great material.
Yeah. So it looks like we don't have any questions. So okay. What I'll do is for those of you who've been watching, we've had probably about close to 10 people who are watching, just kind of watching the whole time. So for those of you who've taken your time out today, we appreciate that. And any last things you'd like to say before we see you in a couple weeks?
Yeah, like I think most importantly, in today's modern world, where so much is done online, some things kind of have to be done in person, and we're just never going to get away from that as human beings. And having skills in your pocket to be able to be used when conflict starts goes a long way to help you feel more comfortable in your day-to-day interactions with people. I mean, if you've ever looked at one of those videos of somebody acting up and you think, oh my gosh, what would I have done if I was there? You can actually go to a presentation that will teach you exactly what to do. And I'm very excited to be able to share those with you and to help you feel safer and more capable in those really uncomfortable situations.
Cool. Well, we look forward to it, Jason, and thank you so much for your time today. And everyone else, have a great weekend.
Thank you.
Oh, we do have one little comment I just want to show.
Oh, yeah, thanks.
Can you read that, Jason?
Yeah, some great takeaways for daily interactions. I mean, I got to tell you, I think this kind of interaction stuff is applicable to a wide variety of different interactions we might have on a day-to-day basis. And it isn't just conflict. It's oftentimes just, daily interaction. Like, I don't know why this is popping in my head, but this is popping into my head. So took my car in for repair, and I get in to get the car back, and like this, my seat is broken. You know that little switch you move on the bottom of the seat that slides your seat back and forth. Like I have inexpensive cars. I don't have power seats. I have the old timey spring loaded one, and so this thing was broken. Like not just a little bit, like totally broken. Like I'm sliding back and forth, right? And I'm a big
and
guy.
You're tall too, so
I can't be sliding back and forth in the car, right? Like I gotta have a car seat that's. So I go back into the desk and say, hey, what happened to the seat? The seat is broken. He's like, that was broken when you brought it in. I'm like, yeah, no, that wasn't the case. He's like, well, you didn't put it on the form. It was something for us to fix. So like, that's on you. And I was like, okay. I said, look, man, that's really not going to work for me. What do we need to do here about this? I just sort of let that long pause happen. Just kind of look at him like this. And kind of let him do it.
Stand over him like that, though, did you?
No, I didn't. What are you talking about? It wasn't one of those deals, right? So like there are ways to interact with people in an environment like that are more conflict, that are more pro-conflict, and there's a way to be able to like hold a firm boundary with someone and not be a jerk and not act up. And maybe that'll be next year for me. But I just said, that doesn't seem fair. That's not going to work for me. And there's a long pause. He's shuffling some papers, and I said, is there somebody else here I need to talk to, or is this something that you can help me with? Long pause. All right, let me go take a look at it. So he goes to take a look at it, and sure enough, they do fix it, right? And so that's just an example of those sorts of like daily interactions that I think that we could all benefit from learning a little bit more about, right? And so we got a good comment. Yeah, from Mac. Like,
oh, good. You can see those.
I can. Yeah, they're popping up here, right? So yeah, so Mac says he's a fairly big guy. Yeah, great. These are great questions. These are great questions. So here's what I'll
face for a minute.
Yeah, it's all good. Well, I'm going to give people a chance to read it too, because this is a really great question that gets to the heart of so many things that we're talking about today. Thanks, Mac, for your comment and question. So first of all, I'll say, like, being big does not insulate any of us from this, right? I'm about 6'2", 200 pounds. I'm not sure how many kilos that is for people, but you can figure it out. So it's like, I'm a big dude, but I've had more than my fair share of people who tried to behave like this toward me. So I guess my advice for smaller folks is the same as for bigger folks. Like, understanding and being able to hold these boundaries and being able to de-escalate this is really, really important, right? And so, especially if you are mobile, if you're in the client or patient's house or area, if you're doing medicine or training or whatever. And so, do I recommend self-defense? I would say yes and no, right? So I recommend it in that it's good to be able to have a physical skill set, but I think the question kind of talks about the way we're stuck, the way we are sort of culturally stuck when we think about self-defense. We think it's only the physical stuff. And I think it's not only the physical stuff. I think it is really the full spectrum of how we handle conflict and how we keep ourselves safe, right? And so, in my view, if I ever have to get to a point where it gets physical, I see that as a failure on my part. I'm competent at the physical stuff, but if I have to use those skills, something has gone wrong. I haven't recognized the problem, I haven't been able to de-escalate it, or I haven't created space between me and that situation. Those situations are, nobody wants to be in a place where we have to be physical. There's the sort of physical injury potential. There's the legal exposure. There's the issues if you have like a healthcare license that can get you jammed up there one way or another. There's like the mental and emotional stress of being in one of those situations. We're trying to avoid that at all costs, and try to create as much space between us in a situation like that. So talking about and having verbal and interpersonal de-escalation and interaction skills is super important. So do I recommend de-escalation training? Absolutely. Where can you get escalation training, de-escalation training? Well, you can sign up for the live stream or in-person San Diego Pain Summit, and I'm going to give a 40-minute block on exactly how to do that, exactly how to recognize when people are spinning up their conflict and when things are starting to get dangerous, how to de-escalate things when they happen, and if you're not able to de-escalate it, how to create space between you and that situation to keep yourself safe. And I think one of the most important books I'll recommend is The Gift of Fear by Gavin de Becker. I'm glad to have that. And I'll have a couple other books as recommendations when I go in there too, right? Yeah, what a great way to put it. Physical violence is a failure to communicate. Like, I could not have said that better. That's spot on. And you just think about all the situations you've been in your life. Having to get physical, like, it's a very, very small percentage of it. And yet when people talk about self-protection or self-defense, they want to spend all their time and attention on this tiny, tiny little part of it, right? So sometimes I talk about what we need to do in long-term health and therapy for people with chronic pain and functional mobility problems. And I talk about where the need is, where the benefit is, and where the investment is. So when we look about how successful someone is going to be in recovery from chronic back pain, say, right? The biomedical stuff that's going on with their back is a small percentage of how they're going to do. And that's where almost all our investment is in the medical system. It's in that biomedical stuff. Where have we put investment on coping skills, on sleep, on nutrition, on staying active and healthy, on being connected with your community socially? The biopsychosocial system that Rajam has done such a good job of bringing people together to talk about for the last several years. Where is our investment there? Well, it's almost none, right? So self-defense and physical, it's a little bit like that. We spend a lot of time talking, and there's 700 million YouTube, 1,200 different systems of you can study of how to punch or grab somebody or whatever, and that's a lot of resources spent on a really small part of the problem. And the much larger part of the problem is recognition of danger and interpersonal verbal de-escalation. And that's really what I'm going to try to deliver for people here too, to help balance out that equation in terms of where we're investing, and give people an opportunity to build those practical skills they can use the next day.
Cool. Yeah, and
Physical
I believe he's going to be there.
Failure to communicate. I love that. I'm gonna quote that. I'll have to put that in my presentation now.
Put
That's
that
great.
back up
Yeah, it is a failure.
Yeah, because in my I did before I moved out here, I did do some jiu-jitsu training, and it's basically, you really just want to walk away. You want to be in the situation. The best thing to be able to do is to walk away from it escalating. So, and I believe I'm sure most forms of martial art teach that. Like, it's better to just not even get to that point.
Yeah, I would hope. Yeah.
All right. 100%. So, so no more questions have come in. Again, thank you everybody for watching. And Jason, we really look forward to your talk here in a couple weeks.
Yeah, it's going to be great.
All right. Thanks everybody for joining us today.
I look forward to seeing you soon. Thank you.